Banded hip distractions are not going to be the absolute fix and cure for FAI syndrome or hip impingement. You might be surprised what I'm about to say. Hip impingement or FAI syndrome is an adult or young adult hip condition that causes quite a lot of pain in the active population, and often it can be slow, gradual, and can progress and persist for quite a long period of time. Now, if you're one of those people, or you've got patients that have got FAI syndrome or hip impingement, no doubt at some point they would have looked online for some treatments, they would have gone on some sort of social media platform, or even healthcare practitioners that may have given these banded hip distractions as a treatment tool. Now, this is really important. This is something I'm really passionate about trying to explain, because treatment for hip impingement or FAI syndrome has to be very specific and bespoke to the individual. Now, hip impingement is essentially changes to the morphology of the hip or the makeup of the hip, meaning that certain things are stiffer. Now, if your hip is stiff as a result of hip impingement, I kind of get that the focus is going to be on trying to loosen it up, increase range of movement, and then the symptoms become pain-free. However, the thing to consider here is that when your hip is stiff or has a loss of range of movement when you've got hip impingement, that has been a slow and gradual process and isn't because of a soft tissue tightness the majority of the time. So when you're doing things like hip distractions with a band, and I'm talking about like when you've got the band around the groin and it's pulling it out sideways or up to hip flexion, that's not a bad thing, right? But it's not the best thing for this kind of treatment. And I'll tell you why. Because what you're doing is not distracting the joint. The hip joint is such a robust sound structure with all these ligaments that keep it nice and snug and tight. In order to move the hip joint, so move the ball in the socket, maybe up to 8 to 10 millimeters, it takes far more strength that is tolerable and that is able to be done in comparison to what you get done with the band. So let me break this down into, if you're someone who's going for hip surgery, right, a hip arthroscopy, to get into the joint, part of that surgical procedure requires the ball in the socket to be distracted because they have to get into where the joint is to tidy and clear it up. In order to elicit that much of distraction in the joint, the hip has to be put under traction using a machine that requires quite a lot of force and strength in order to maintain and sustain that degree of traction. Now, to do that with a band is really challenging, if not probably even possible. So when people are being treated for hip impingement with a band, the ball in the socket is not moving. Don't get me wrong, some might feel the benefit for short term, but that's more of a process of your brain and the tendons and the muscles adapting to what's going on, and it's often a transient short-term outcome. The difficulty and the problem that I have with this is often when it's given, those exercises might put the hip into a range of movement that is quite provocative, that is already a bit restricted and stiff. And what happens is you run the risk of irritating symptoms further and causing other issues. Because if the hip isn't moving in that direction because it's stiff due to the makeup and morphology, well, really doing that more with a band around it, pulling it out sideways, isn't going to be the best thing for it. It's really important with this to explain though. One last point with this, just to kind of make it really, really clear. If you've got no hip pain and just a bit of stiffness and tightness and you're doing the band, that's not a bad thing. These are safe exercises to do on the whole. But if you've got someone who has hip impingement and there is a morphological makeup change that's causing that hip to have a loss of range and stiff, and the primary focus is on somehow trying to stretch it and do hip mobility and banded distractions, really that's not the way to go with this stuff, because actually it can provoke symptoms and make it worse. In order to get the best route of understanding how to manage this, understanding how to treat it, because ultimately people who have hip pain from hip impingement, ultimately want treatment. They want guidance on how to manage it. They want the best kind of treatment. In order to get the best outcomes and in order to treat it as effectively as it can be treated, well, really the first port of call and the best port of call is to be doing hip rehab exercises, which I'm actually going to show in one of my upcoming videos. So make sure that you click and watch now.